meeting you yesterday. She will give us the Italian perspective now.
Good morning, everybody. I don't have any slides, so I will follow the example of Sherry. And the situation in Italy is not that easy, but I think it's a thought that we could do in every part of the world, because no lipedema patient has what should be required to have proper care. We are still in the hands of some dedicated pioneers, doctors who helped us. Sandro Michelini is one of them, and I think maybe every Italian patient with lipedema is grateful to Sandro Michelini for what he's been doing in the past 20 years. But we were alone in this, only with the help of these pioneer doctors who do not have any help from the state system, and so we can rely only on their dedication and passion and their strong will to help us. And but this is not enough. So I believe the turning point was in 2018, when the WHO recognized lipedema in the ICD-11 classification. We decided to found this association for the Italian lipedema sufferers that is called Lio Lipedema Italia. I chair this association right from 2019, and with the help of these pioneer doctors who helped us in this from the very first moment. And then we started, because in Italy there was no treatment at all for lipedema patients. We had only, it's the same as Sherry was describing for the UK, there's no difference. We had treatment for lipedema, lymphedema, treatment for obesity, treatment for cosmetic stuff like paniculopathy or cellulite, we call it, but not in the inflammatory way. And nothing, we had nothing. We still have nothing because unfortunately the difference is that in Italy we still pay everything out of pocket. Nothing is passed from the state to the Italian lipedema patient. I'm very happy that in other places the situation is a little different, but we do not have nothing so far. So it's a question of, we know how to treat lipedema, we can't afford lipedema treatment. This is truth. So in 2019, we managed in one of the lymphedema congress organized by lymphedema specialist and Dr. Michelini, he invited Karen Herbst in Italy for the first time, and he invited Dr. Frank Lapsches from Germany. And it was the very first time that we were hearing about lipedema speaking with no confusion with lymphedema at all. I remember that day very well, because they were looking at Karen Herbst and Dr. Lapsches. So weird, what are they saying? But surgery for lipedema, really? You don't have to have surgery because lipedema comes back after 1 year, and a lot of stuff. That it was so revolutionary that I remember that session, because it was a turning point for us. Because when we go to, once we're going to a doctor, for us meaning we can do nothing for you. And for me personally, I was so desperate personally, because I was wheelchaired, and it's it's not possible that I couldn't do nothing for my disease. And I see all other people starting to speaking with people, finding a lot of people in the same situation. That's why we decided to found Lipedema Italia. And then we started to looking at something abroad. So we met the amazing ladies from Lipedema UK. That we started, ladies, we want to start working together because we feel lonely. But if we start making things together, we will have the power and a super powerful voice. And that's exactly what we are trying to do now with the Lipedema World Alliance. Because after the foundation of Lipedema World Alliance, you know that Lipedema World Alliance is born in Italy. And in the day last year, when it was in the day that we signed that Constitution Act, it was me, Dr. Sandro Michelini and Dr. Serena Michelini, that day where it started, I felt that something so huge was becoming a reality, and I see it here today with I'm speechless. I'm sorry, because I could have prepared some slides, I could have prepared a lot of stuff to speak about the situation in Italy. The situation in Italy is still desperate, but we are not alone anymore because we created something together. And so we have the force and the power to change things together. And this is the only thing that I really want to, we have the power to change only because we are here in this amazing congress. Thank you to the organizer for this. And all the effort that all the people in Lipedema World Alliance are putting, hours and hours of volunteer work. Also, Dr. Krupa was a hero for everything that he managed to make to have it ready for today. We're not ready for everything, but you can forgive us because we put a lot of effort in it. And we have a website online. In the last 2 hours it was put online, so please visit the website. It will be a pleasure to have you as regular members in the Lipedema World Alliance regular members section. It will be ready very, very soon, but if you want to start giving us your email address and your contacts, we can reach you as soon as the regular member procedure is I have this thankless role of being the General Secretary responsible for the admissions, but it's just secretarial duty. I don't decide personally. But so if you have any questions about what we want to do, please feel free, because it's something that we can do together. And I think also Italy could benefit for this because we have this long working pioneers from 20 years. We have this new generation of doctors like Serena, and you're meeting a lot of other people from Italy, physiotherapists, nutritionists, surgeons. They are helping us a lot. We are trying to build up a very important lipedema community in Italy. But I don't think we can do better than this without your help. We owe something important to all of you in this place. To the fat disorders, for example, without your amazing website, you teach us a lot. Without the works of Lipedema Foundation, thank you. I can name all of you, but really, I am so grateful to all of you there, because personally, if in this moment I walk, it's because of you, it's thanks to you. It's not only my personal situation, but I represent all the people in Italy that are still alone and abandoned and don't want to be abandoned anymore. We can give those people, and we are a lot, a hope
there is a practical hope because they can be treated, they can be taken good care, and this is thanks to all of you. So, and then my only word for you is thank you.